Hello, welcome back. The topic today is the difference between hemorrhoids and anal fissure, or the piles or fissure. So, most of the people, when they have a problem in the bottom, they always term this as a piles, but mostly it may not be. So, usually, piles or hemorrhoids is nothing but enlargement of the normal blood vessels. It's all elongated, enlarged, or engorged blood vessels, normal blood vessels. And fissure is nothing but a cut. The mouth fissures, like that same way, there is a cut in the anal region. So these are the main thing. And the piles is usually painless bleeding in drops. So abnormal enlargement of the or engorgement of the blood vessels, painless and bleeds by drops and drops, either in the beginning or end of the passing stool. Very rarely it can get into pain. And fissure is nothing but a cut. So definitely they'll have a pain, burning, itching kind of pain will be there. And mostly during the defecation and after 1 hour or even 2 hours, the pain may remain. So this is called fissure. So how they present to the doctor generally? So generally they can feel, the pain. Second is bleeding. So this can differentiate. In the fissure also sometimes there will be bleeding, but it's called hematogesia. That means there is a cut. So like our mouth ulcers. So the anal ulcers, the anal canal become you know restricted in this caliber. So they keep pushing the motion. When the motion comes out, it always erodes or corrodes or even tear the mucosa. So there will be bleeding, but there will be streaks of blood along the superficial layer of part of the motion. That's called hematogesia. There is no drops of blood, but only streaks of blood. This is hematogesia, that is fissure. So, and once piles happens or hemorrhoids happens, mostly it's greater 1, 2, 3, 4, and if it is more than 2, generally it won't go back. It won't shrink. It won't disappear. It may remain silent inside, may not be bleeding, but it remained there. But fissure can heal on its own. It can happen temporary, acute. It can happen just like that in 1 day, and it can heal on its own. Or it could be a chronic one. It's a long-standing fissure. And mostly there will be both the reason is constipation, obesity, sitting prolonged, and less fiber diet. These are the main reasons. And even fissure can happen sometimes temporarily because of some drugs. Suppose we are taking painkiller, antibiotic, or steroids, or even chemotherapy medicines. They can cause fissure, and once these medicines are stopped, probably they may heal on its own and they'll recover back to normal. Or it could be a long standing one, like suppose it can they lose weight. Suppose they are obese and they lose weight very fast, fissure can happen. And mostly what they say is my body heat, they say. There is nothing called heat. There is a wound, or there is a ulcer kind of wound that can cause this kind of heat generation, but it's a fissure. And the other big thing is mostly what people they say is I have a skin tag. When I pass motion and when I wash, I can feel some growth of skin. Mostly that is fissure. The reason is the fissure can heal it on its own. Either it can be temporary or chronic, but it heals on its own. So the skin covers, and over a period of time, the skin, also overgrows the size and comes out. It looks like a extra growth of skin. That's called sentinel tag. That is mostly fissure. And people with piles, they say, I have a lump or I have a mass which comes out. Either it goes on its own, I have to push it inside. So they say mostly mass. These people say extra skin growth. These are the main differences. But whatever it is, definitely you need to go to the doctor. He has to examine. Probably you do a rectal examination, you do a proctoscopy, or even sometimes ask for a colonoscopy. Then they will conclude this is your problem, and they can advise you conservative treatment or surgical treatment. And if you are above 40 years, colonoscopy is a must. The reason being, these piles or fissure could be sometimes a symptom of internal disease like cancers or even TB or even inflammatory bowel diseases. They can cause these things. So if you are above 40, or even for some patients, whatever the age, the doctor may ask for a colonoscopy. And whatever the diagnosis comes, your doctor will guide you what is the best treatment for you. Thank you.